Hello everyone, I'm Sanchika. I'm from ECHO. A very warm welcome to you on the Cypher ECHO webinar on good and replicable and innovative practices of tobacco control in India. Today we are into the 10th session of the webinar series, and the topic is Yellow Line Campaign. Today we have joined with us our chief guest is Shri, Vilas, Sandeepan, Bhoskar sir, who is the Mission Health Director of National Health Mission, Government of Chhattisgarh. And also the subject matter expert for today is Dr. Kamlesh Jain, Professor, Department of Community Medicine, State Nodal Officer, NTCP in Chhattisgarh. A very warm welcome to both of you.
Thank you. Thank you very much.
Now, I would request Mr. Arun Verma, who is the Director of Finance and Operations, for the welcome address.
Thank you, Dr. Sanchika. Thank you so much. I am extremely delighted to welcome our chief guest, Shri Vilas Sandeepan Bhoskar IAS, who is a Mission Health Director, National Health Mission, Government of Chhattisgarh, who is likely to join in a short time, being in the urgent meeting with the SS at the moment. I also welcome our expert of the day, Dr. Kamlesh Jain, who is a Professor, Department of Community Medicine, as well the State Nodal Officer, National Tobacco Control Program, Chhattisgarh. I welcome Dr. Rakesh Gupta, President Cypher, looking tired. He's returned from a foreign visit last night only. I also welcome Professor Sonu Goyal, who is a Director, RCTC, PJ, Chandigarh. I welcome Dr. Sanchika Gupta, who is a Manager, Project ECHO India, who is our partner for this webinar. I welcome Mr. Rajeev Chaudhary as well, who is a Program Coordinator with the RCTC, and our eminent participants and public health students. As you know, the Strategic Institute of Public Health and Education Research was established way back in 2018 with the fundamental purpose of creating a specialized public health workforce that can plan, execute, and monitor national health programs and public health initiatives for tackling emergency public health issues and challenges. We are working on all public health issues with a special focus on the non-communicable diseases. In the last about 5 years period, we have organized close to 100 physical as well as virtual workshop and consultations. We work mostly in coordination with the Resource Center for Tobacco Control from PJ, a joint initiative of the PJML Chandigarh and the Union, which is emerging as one of the most sought after platforms that showcases tobacco control initiatives, updates, policies, resource materials, etc. from length and breadth of the country. It has helped in strengthening the national control work program to a greater extent. I welcome everyone once again. Over to Dr. Sanchika.
Thank you, sir, for the welcome address. Now we request Professor Sonu Goyal for discussion on the objectives of the consultation.
So thank you, Sanchita, and thank you, Arunji, for such a nice introduction. And it is my privilege and pleasure to collaborate with the Strategic Institute for Public Health Education and Research, which is doing a excellent work in the area of not only tobacco control, but non-communicable diseases and overall public health. So Dr. Rakesh Gupta, President Cypher, Mr. Arun and their team, I think should be applauded for this effort which they have been doing.
Sanchika, please change the slide. Yeah, please change the slide. Next.
For last over 3.5 years. So it is my again pleasure that ECHO now has been collaborating with the Strategic Institute of Public Health Education and Research, and Resource Center for Tobacco Control is providing technical support to Strategic Institute of Public Health Education and Research in conducting these very important webinars on good practices in tobacco control. So in this series of a webinar, this webinar by Dr. Kamlesh Jain, who is a good friend of mine.
Thank you.
So, and not only a excellent researcher and academician, but also a good implementer. So he has that quality of not only being from community medicine and working in academia, but also working as an implementer, program officer for NTCP. So this is a unique, dubious distinction which Dr. Kamlesh Jain has. And we all look forward to this very important webinar on Yellow Line campaign, because you have been witnessing various, you have been witnessing various you have been witnessing various webinars in the past as well. And this webinar on Yellow Line campaign is a very unique initiative in strengthening, especially Section 6B of our Cigarette and Other Tobacco Product Act. So I will not be in between this webinar, and you can see the what government of Chhattisgarh is doing by having the presence of Shri Vilas Bhoskar, who is MD NHM, presence in this webinar. So that strengthened the fact that Chhattisgarh has been doing excellently well in tobacco control, and the presence of the top leader or top brass of the government functionary is the testimony of the fact that they are doing excellently well. So without taking much of the time, I congratulate again Cypher for the excellent work which they have been doing for last many years. So now over to Sanchita for
Thank you, sir.
next questions.
Now, I would like to introduce our guest speaker for today, Dr. Kamlesh Jain, who is a professor in the medical college and is having additional responsibility as State Nodal Program Officer for Segment of National ID Disorder Prevention and Control Program, NTCP, National Oral Health Program, PM, National Dialysis Program, Public Health Gather Development, 104 Medical Helpline, among many others. Over to you, sir. I will display your PowerPoint. Just give me a second.
Okay. Thank you very much, madam. Sorry for the some of the technical issues, but I am using mobile right now. But will try my best to communicate the very important initiative which promotes this empower strategy, and P is one of the important strategy.
Can you see slides, sir?
Yes, I can see.
Okay.
So first of all, thank you for my introduction, and thanks to Cypher, Dr. Rakesh Mahajan sir, Dr. Rakesh Gupta sir also is here right now, his eminent presence, and Professor Dr. Sonu Goyal, who is supporting Resource Center for Tobacco Control from PGI Chandigarh. We all are working for tobacco control across the country. And I got this opportunity to share the Chhattisgarh initiative, and particularly on a Yellow Line campaign. So in that way, I'm here, and definitely I welcome all the participants who are taking interest, and almost 58 participants are already here and taking interest on it. And I will use my both as I came to know heterogeneous group is there, and many participants are. I will speak in English, but sometime I will speak in Hindi also, so that everybody will understand what we would like to share from the state of Chhattisgarh. So first of all, I would like to share some context before getting into before going into the topic of 1 minute. Hello, are you able to hear me?
Yes, sir. हम सुन सकते हैं आपको.
Now I got my laptop also connected, so that's good. So Yellow Line campaign, before going into the topic, I think we should set the background. Why we are doing all these things and in a campaign mode, or what is the issue right now? So tobacco control is tobacco is one of the major issue in a public health public health domain, and I rated as one of the topmost high risk factor for non-communicable disease. So this is very much clear to all. I don't want to go for the theory of it, but definitely everybody will accept it. If we will able to control tobacco, then only we will able to in a significant way non-communicable disease. We will able to control the non-communicable disease either in hypertension or a cancer or other lung diseases or any other peripheral vascular diseases. So these are very important emerging diseases which need actually very high cost to take care of it. And prevention is a better than cure. And for that, the government of India, even the WHO, even the other organizations, the union and other stakeholders are working together to how to make the strategy to control it. And as a very powerful strategy which is working right now is Empower. Across the country, we are working for the Empower, MPOWER. I'm not going into the details of Empower, but I'm just focusing on the P part. It's a P is a protect and from tobacco, and it's a promotional activity for the tobacco control. So how we would like to do the promotional activity for the tobacco control, either through the IC methods, through sensitization, through some motivational program, through any campaign, and other way. That is the one of the strategy which is a very prominent right now, and across the country. If you want to go for any control of disease through empowerment, like a by the enforcement, so it is very difficult to control it as hmm, looking into the population of India. But fortunate part is that we have a very good act on tobacco control, which is a the Tobacco Control Act. It's a COTPA Act, Cigarette and Other Tobacco Product Act. So Act is another part, but we want to work for it also, and we want to use these IC information, education, and communication, or through any other through other methods, so that these act will be also known by the people, and these other factors of tobacco will be known by the community. So what will be the good strategy? So we also came to know through various studies, like a GATS study or a GATS survey or a youth survey or any NFHS 5 survey reports. You will come to know, yes, India, there is a huge problem of tobacco and users are very high. In Chhattisgarh, if I want to rate it, previously it was in 2009, it was a 53% users. Now the 39.1% users are there. So this is one important point which I want to make it. The second point, this yellow, this youth. The youth are the one of the important source from for the inception of tobacco actually users. And youth are in right now in schools, and they are out of the schools also, and they are in the schools. And once the peer pressures and other things are going to start, the bad habits can be percolated into the systems of children. And this is tobacco is a highly accessible or available product, which is very much harmful for the youth. And the survey is also saying, previously in 2009, you just go through the youth survey to 14 almost 14% people are using, 14.6% people were using this tobacco in a youth 13 to 15 years. Now with various strategies, we have brought down it up to the level 8.5%, which is less than 14.6. It is true, but I would be still concerned, because 8.5% children are using in between the 13 to 15 is still, which is high. And across the country, we need to work hard, and we need to reach up to the this children. We need to reach to the schools, because this is a highly addictive model, the product. And young can reach through educational institutions if the products will be very high product availability will be very high through the selling points surroundings the school. So what we would like to do this, so government of India is doing a lot of strategy. They have sent various guidelines to us before starting that toffee tobacco free education institutions. Some of the states started actually some of the different ways, and this yellow line campaign is one of the part of it. So what is yellow line? It is not a miracle. It is not any new invention. It is a just initiative which makes us some attractive to know what is it. If you will find any yellow line, suddenly if your office or any school which is very good right now, and the gates are available, the people are going inside outside coming out, it is like that. But suddenly if you will start something to make like a yellow line is a big broad strip outside the school, everybody will see, the even children will see. Previously it was not there, but now it is available. What is the reason behind it? Everybody will ask, the queries will be even the community, even the rickshaw puller or a auto or a mother father who are dropping the children outside the school, definitely they will ask what is it and what is the meaning of it. Then the curiosity will be high, and we will get the chance to explain what is it actually. So now this yellow line campaign is a symbol. It's not anything a new thing or any guideline. It is any rules or regulations. Okay, please, these yellow lines would be available outside the school. It is not written anywhere, but we wanted to use for this tobacco and tobacco control, and we used one Kotpa Act, and this is a section A and section B. You know very well. I think the previous slide, which was showing 6A and 6B, these are very important guidelines where the government of India, even the Act, Kotpa Act, is saying that we cannot sell tobacco in surroundings of schools in 100 yard, or even the minors cannot sell, or a minors cannot uh, purchase this tobacco product. And these under the act, and we can punish them, we can make some enforcement on it. So these two sections actually we used to promote this activity. Next, maybe my slide are not aligned the way I am explaining, but I will try to align with the slides. So this is a very important thing. Yellow line campaign, we started it. Just we wanted to do something. Yes, I will speak something, some challenges also. But first, what we started before the entrance of a school, we wanted these yellow line broad, like a 3 inches broad or something. Letters will be like a 15 inches. Letters we can use, and these tobacco free zone, tobacco control zone, tobacco free zone. These type of letters we will use through with by using a yellow color, okay, strip. And we wanted to say, yes, there is nobody can use tobacco inside the school. That type of sensitization, every child, whoever will cross, even the school staff or a parents will cross the this strip, everybody will read this is tobacco free zone. So at least people will understand there is something going on related to tobacco, and government of India is doing some effort. Government of Chhattisgarh, any government is going to start, has already started the campaign on it. So this 100 yard is very important. We wanted to use this yellow campaign across surroundings the schools actually, but it is very difficult. It is a symbolic, and we cannot use the whole surroundings of a school because it will take too much time. Also it will also burden on a finance part also. But definitely through symbolic method we wanted to say, even we wanted to inform the school, the shopkeepers who are very much near to schools can don't use tobacco, don't sell tobacco product. The school teachers and others who will be part of the committee, where we will make it some committee members, where the school children, class representatives, some of the very interested staff will make a committee, and they will the members of the committee will introduce the shopkeepers ki what is going on across the school or nearby our school. So please don't. So definitely first they would like to inform them, they want to educate them, they want to say ki yes, please don't sell it, it is very harmful. So like that, first do these things. If they are not accepting our plea, they are not accepting our appeal, then you should go for the enforcement. And enforcement, it is not easy. I would like to share my state, Chhattisgarh. We have not achieved a very good number, but definitely the main the resistance which we received from parsad and local leaders who are very much caretaker of these small shopkeepers, why you are affecting the livelihood of these small shopkeepers. This is a very lead question, and we should have some answers or reply to this parsad and the Mahapors are the local leaders of the community. And that's why we should have a very good linkages between the education department and the once the children or some of the group of the children will explain, they will understand very well. So this yellow line campaign of Chhattisgarh, we started in these way, like a yes, yellow line campaign use, and the children or some of the staff teacher will go and explain. So these way yellow line campaign we conceptualize. We are not saying that we are the only state we are following this yellow line campaign, other states are also using, but I wanted to share these things that yes, it has some impact and it will have some a very positive indication towards the control of tobacco. Next slide. So just I have already explained, drawing the yellow line around the periphery of 100 yard of the school is especially from the main gate. Why we are using main gate? Because finance part, because you want to use the paint and other things, brushes, so and it requires manpower. So we should start from first main gate. Yes, I would request to the others who are listener right now, based on the evidence of our state, please involve the local people. Definitely, if some of the very good richest man or rich man of the community or some private stakeholders or some civil society stakeholders would like to support this type of activity, and they will purchase your paint or a brush and give it to give this donation to the schools for this very small activity. Even parsad will support if the parsad will be sensitized on it. So there is no requirement of too much money from the tobacco control department. They are only these department or health department can give or education department can give in a some symbolic manner. But if you will use local fund, it will have a very good impact. So the important point is that people will understand when you will put any statutory warning outside the school, and this is a very important and essential part of this yellow line campaign, even for the toffee tobacco free education institution, which has been initiated by government of India across the country. And now the formation of the committee, which I have already told, when you will make some committee, then only the impact will be there. There will be some task force, the members will go explain to the community, even explain to the shopkeepers, these are the things. And some of the internal raids is also important across the if you will go inside the school, some of the children are using this aid, and you do some raid activity, and then only the children will understand, and the principal will take some actions, or teachers will take some actions on it. So this is very important, and I have already told, warning and educate the vendors around the school. This will be a very important part of it. Please, next. Yeah. Oh, previous one, ma'am. I think so. Previous one will be. So now the involvement of the department, I just wanted to share the who can be part of this yellow line campaign. I'm really telling you, as health department is a pivotal department, because the health, ultimately health is impacting, health is the only sufferer department, because human health is being impacted by the tobacco. That's why we really बोलते हैं ना, एक कहावत है, मरता नहीं क्या नहीं करता। तो जब जिसके ऊपर गुजरती है वही, तो हम सच बताएं तो हेल्थ डिपार्टमेंट को दिखता है मरीज। और जब वी सी लॉट ऑफ पेशेंट्स इन द रीजनल कैंसर सेंटर्स और स्टेट कैंसर सेंटर, then only we are able to understand, and every patient is having, you will not believe, in Chhattisgarh we have done lot of survey, very school, like a simple survey, even it is not published. We asked the patient, have you used any tobacco product? You will not believe, no one we are getting any answer ki yes, I'm not using it. Everybody is saying yes, I was using the tobacco product, irrespective of the cause. So now I'm telling you, this is very important ki, health department is one of the implementing department and one of the biggest stakeholder, but education department is very much supporting. And now the current IS officer, I would like to, even I wanted to invite him, but I could not get him actually, the Mr. Sunil Kumar Jain sir. He is he's a IS officer and taking care of the school across the state, and he is very much proactive and wanted to launch this toffee across the state, and wanted to tobacco control initiative through the school department. Even our mission director, who is right now chief guest, he is attending another meeting of additional chief secretary right now, would like to, even he asked me, okay, please, I would like to address this very good initiative. Actually, he only called up me on this matter. So I'm very much happy, and he himself is one of the person who speaks about don't use tobacco, and whenever he is using any meeting, he always talks about this tobacco control for at least for 1 or 2 minutes. That is a greatness with us right now, with the mission director of Chhattisgarh, Mr. Vilas Bhoskar, IAS. So this is one of the important thing. Education department is, yes, if the panchayat department can also support, if the village level schools are there, definitely the urban development department. But I'm telling you, the civil society partner will be one of the great stakeholders for us, and the local leaders and local supporters, rich men who would like to give some donations for this type of activity. Thank you very much. Next. Yes, thank you. So now I'm just sharing the journey of 5 years, but the schools, yes, the initiative is started through the state. That's why we are using top to bottom. But out of now, right now, actually we have 5 more districts, but 28 districts already started this activity, and we 14,000 schools have been sensitized till the date, and they wanted to do this activity, even they have done it, and the proper certification already around 6,000 schools. But one thing I would like to share, as you know, the initiative always innovations always started, and some of the time the government of India or a big state government would like to do some other activity in a other way, तो वो थोड़ी एक्टिविटी को हमको क्या करना पड़ता है, मर्ज करना पड़ता है, लाइक दैट as government of India has started tobacco free education institution campaign. Everyone is asking, what about the toffee initiative, what about the toffee outcome? Government of India joint secretary madam, additional secretary madam, even the others are asking for the toffee. But yellow line campaign, nobody is, but 2 years back yellow line campaign was asking. So now I'm requesting to all of you, it is not a very big initiative, but yes, it has a small effort but has a big impact. So what I wanted to share with you, in a toffee initiative or a tobacco free education institution, please merge this yellow line campaign activity and do it and continuously do it, because it has a visible activity which actually looks yes, what is outside the school we want to understand. This is the only one brain triggering point which I observed. And next, so these type of activities just wanted to share with you people in our schools. And this is a school activity. Now you will not believe, one of the universities started this yellow line campaign after seeing the school. My one of the vice chancellor, actually I'm not able to, vice chancellor or some registrar, so registrar of the Bilaspur, actually he saw yellow line campaign when he was dropping his child actually. And he saw, at least he observed, bole yaar, it is a good thing. Then he approached and asked the NTCP cell Bilaspur, and then the union people went over there, explained, and he impressed with, and he started, he allowed to do this tobacco yellow line campaign for the university campus. So this is one of the impact I just wanted to share with you. This is a impact of one of the yellow line campaign. Next. Don't use this every inside the school. We definitely would like to do it in yellow outside the school, and involve some of the local leaders over there when we are using yellow line campaign, developing yellow line campaign, so that uska bhi ek impact aata hai, and it should be published in newspaper, so everybody will understand what is yellow line campaign. अरे पीली बत्ती तो पड़ी है, लाल बत्ती भी पड़ी है, और हरी बत्ती भी पड़ी है, बट व्हाट इज दिस पीली लाइन, तो थोड़ा सा एक इंटरेस्ट आ जाता है. नेक्स्ट. Yes, it is very important ki if anyone is issuing order, like government of India will write a letter to our chief secretary or our health secretary or additional chief secretary, ki please start the yellow line campaign, definitely it will work. But right now we have a letters for the tobacco free education institution. We are definitely under pressure for toffee. But now you will see the mission directors and a director health services has written for letters to our district officials for the yellow line campaign. So this is one of the good thing for the commitment. Next. These are the letters which we have used it. Even I wrote the letter to the all district officials, please do this activity. Even the district collector or the CMHOs has written letter to the all stakeholders, please apply this yellow line campaign. Next. These are the initiative. Actually, we started this initiative in 2018, and after that. So now I just wanted to come land into this challenges, which is very important. 100 yard, yes, yeah, it is a demarcated area, and it is under the act also, and we wanted to do for the whole radius, but it is not possible. So this is one thing which we can do it for the whole radius if it is possible. It is not part of the टॉफी डिक्लेरेशन. अभी थोड़ा सा लोगों में क्या होता है, टॉफी की जो गाइडलाइन गई है तो उसमें हमारे को इसका पार्ट नहीं हो पाता. So if we will merge into, because nobody can prevent it, nobody can stop it. If the government of India has written something for the toffee, okay, but if state government would like to add some good point which is not affecting anything but will have a very good impact on the whole initiative, then we should add it. So it should be added, although it is not a part of right now the toffee declaration or a indicators which has been already made up. Yellow line campaign done on the priority only by the health department. Now we should do by the other department. This is the one thing. And the last but not least, it is very important, if you are using any pant for it, it should be for the sustainable or for a long term. But unfortunately, just because of the rain, just because of the other cleaning activity, it is very soon it is fade away, and again we need to go for the yellow line campaign. So these are the challenges which I wanted to share with you. Next. So I just would like to conclude with some key recommendations. Yes, ownership with the education department should be there. If education department will start this activity in a own way, definitely all 60,000 of schools of the Chhattisgarh will do it in a very immediate way. Within a month, we can achieve all this activity if the education department. So we are we are going to talk with the Secretary Education and Minister's Education very soon, and for the toffee where we can request to for this yellow line campaign also. And yes, education about the alternate livelihood, it is very important, because shopkeepers are very middleman or something like a very low socio-economic status, and they don't want to stop, because this is one of the very high earning high sold item actually for them. So they don't want to stop the tobacco, and somehow छुप करके कहीं से इधर उधर से बेचना चाहते हैं, and Parsad are also supporting on this activity. So this is one thing which we should break it actually, and build the capacity of panchayat members, so that the all village level type of active schools will be very much involved, and the panchayat department involvement and civil society already I have told, and it should be part of the toffee declaration. This is my recommendations, and this is the point. Next. So this is all about the yellow line campaign. It was a very small thing which I have elaborated actually. Even most of the members who are attending it, actually they are knowing about all these things and the way. But as Dr. Sonu Goyal suggested, I am not the only professor in the one academic institute. I am one of the implementer as a state nodal officer. I faced a lot of things in a whole initiative of tobacco control, following all the empower strategy. That's why I wanted to elaborate all these things. And thank you very much for listening this very small but high impact activity. Thank you. Thank you to Dr. Rakesh Mahajan sir, who was really in touch with me, always doing follow-up, and given chance to me to share any activity from the state Chhattisgarh. I try to request to our mission director, if I call him, if it is he is available, definitely I will. Any question, please?
Thank you, Dr. Kamlesh. I think it was an excellent presentation, and you have done a commendable job. Already the prevalence of 13 to 15 years, prevalence of tobacco has been reduced from 17.6 to 88.5%. That is a big achievement. And out of 14,000 schools you have taken up, 6,000, almost 6,000 have already declared as toffee compliant. And that is a big thing. Because we also did a compliance study on regarding toffee guidelines in Chandigarh. And the position was not that good. So it speaks of the effort you have already made. And you have already talked about the challenges, solutions, and you have been able to involve all the stakeholders, including the education department, because it was very important to involve all these departments. So I must applaud you for your work. So thanks a lot. So, and
Thank you very much.
Thank you. I'd like to acknowledge the presence of Dr. Rakesh Gupta from Jaipur. He's from Rajasthan Cancer Foundation. Miss Susan, she's from Gujarat, and Miss Nay Lata, she's a senior teacher in St. Anne's School, Chandigarh. And Dr. Siddhi, and she's from Jabalpur. And many more stalwarts have joined. Actually, I have not been able to read out the names, maybe. But it is commendable that almost 70 people, more than 70 people, they have joined. So I just ask for brief comments of the stalwarts who have joined. Dr. Rakesh Gupta, to start with, I think you can make some brief comments.
Good evening, everybody, again, and thank you, Dr. Rakesh ji. Congratulations, Dr. Kamlesh ji. But Dr. Rakesh, if you will kindly accept, I would let the others in audience first make the comments before I do that. My comments may be a little more probing, so it's good that we have the people from audience speaking about it first.
Yeah. So Miss Susan, Miss Neelata, Dr. Siddhi, any one of you can just give your brief comments. Yes, Susan.
Hello.
Yeah. Yes,
Sir, am I
Susan.
audible?
Yes, sir, you are audible.
Sir, I am on the go, so probably that, yeah, so I'm on the go, so probably my network will falter a little bit, but I will always resonate with Dr. Rakesh Gupta from Rajasthan saying that, we now need to move over, towards tobacco-free generation while we are talking about toffee and yellow line. So it begins with 6B long back, then we started talking about toffee, then we started talking about yellow lines. So in Gujarat, we had done it in all 33 districts way back in 2018 in about a span of 1.5 years, introducing the concept in every district. Reporting or the monitoring system that we need, and probably that will only happen if we can pitch in or pour in the education department to do it as its prime responsibility rather than the health also. So one of them, this is the major thing I believe, and the other thing is that now we need to resonate all of these ideas, 6P, toffee, yellow line, everything with the concept of tobacco-free generation. When do we want to give it a deadline, and all of these initiatives, all our 11 9-pointers being encompassed into this idea of tobacco-free generation only. So if we start talking now, we can expect all of these things to be inclusive in the concept of tobacco-free generation. That is my take on the entire thing. And thank you, Kamlesh, Dr. Kamlesh, for excellent presentation. I believe this is very close to my heart because faith works for youth and de-addiction. So definitely Yellow Line campaign is something that has always been a flagship program. Thank you. Thank you, sir.
So thank you, Susan.
Thank you very much.
And do we have Madam Snehata with us?
Yes, sir. Good evening, sir.
Yeah, good evening. And I may tell you that she's a very, very senior teacher in a very prominent school of Chandigarh, St. Anne's. So what is your take on this Yellow Line campaign?
Yeah, good evening, sir. Today, actually, I would like to thank both the speakers for this. I did not attend it in the starting, but somewhere in the middle, I just connected to it. But I can make out that it's for the betterment for the youth. Number one. Number two, that when we talk about tobacco free, actually, it's not only in the schools or education departments, it's around our surroundings also, as well as, of course, awareness campaigns must be there in the schools on the regular basis. Like for cybersecurity and all, we generally have it like twice a year. So if we can have some campaigns, especially in the schools, and if it comes through CBSE or some education department, like in the form of circular and all, and the senior most members like Mr. Mahajan, Rakesh Mahajan, or any other person who is from Cypher, or anyone can just address the students, I think it will have a high impact. And I just want to disclose one case in one of the school. These days that wipe is also there. So some children, those who are having the belong to the good family, they just bought it and they hide it in the washrooms of the schools. And one by one, students go to the washroom. They use these highly technical devices and all in place of those hookahs and other things. And if we talk about the rural area children, those who are coming to the Chandigarh, just now I discussed, I think with Mr. Mahajan, recently somebody shifted in one of the PG, next to our house. and 7, 8 boys are there. In the owner is saying that he's given it to 3, 4 people only, and now 7, 8 are there. So all are using openly the hookahs and all. Neighborhood people are saying, but they're not afraid of anything. So how to stop? Where to stop? That is my big question mark.
Madam
Of course,
Sneh,
presentation
I
is good.
think we can talk about that one-to-one. But I
Okay.
must say that you have already received directions from your education secretary regarding this following of tobacco-free guidelines, tobacco-free
Yeah.
education institute guidelines.
Yes,
So
yes.
you must, I think, and Cypher will be very happy to join you in this campaign, right?
Yes.
So thanks a lot.
Thank
And
you, sir.
now
Thank you.
thank you. Now we have Dr. Siddhi, if she can give any comment.
Yes, sir. Sir, I have heard a lot about this campaign, but does it only deal with sale of tobacco products around the school? What about inside, the technicians, the attenders, people who are coming in and out of school, or parents? Uh, what do we do about them?
Actually, that is already covered under Section 4.
Yes,
So nobody can use the tobacco products within the schools, within any, in fact, public place. So that is already there. So I don't think it covers this yellow line campaign is for any points of sale
point
within
of
the
view.
100 yards. Yeah.
Yeah,
Yeah.
but
And again,
I would say, but this once the parents or anyone who is dropping the children, I have already shared these things. They will have a curiosity to know what is it actually. Then only we will get the chance, and when the children will explain at the home why this type of campaign is going on. So this will have another impact. So it's a byproduct. I would say these children will at least explain to their parents. So this
parents.
is one chance. Other activities are also going at the community level, like a Mitanin or Asa. They are also educating the community, but still this is another actually byproduct of the yellow line campaign.
Sir, I
Yes.
am a public health dentist. I try to talk with sports teacher and principal as well, that you keep checking bags every now and then. The washrooms, as ma'am also said, that if you get anything suspicious, any packets as well, so please be aware of it. And the e-vapes and all, e-cigarettes, that has to be, I mean, teachers don't know that it can mimic a I mean, spray bottle as well. So that thing we need to,
Yeah.
lipstick and all. So
So thank you, Dr. Siddhi, for your comments. I'll request all the participants. So there is a question from Deepak Patil, and there are so many people from Northeast sharing from Mumbai. So anyone can just give his or her comments, please, on the issue. Deepak, you can say first. So what's your question?
No, sir. Just first of all, I would like to thanks Dr. Kamlesh Jain that he has really done good presentation and explained the real pictures of Chhattisgarh and the Yellow Line campaign, whatever he has done, the success in Chhattisgarh. So, Salambai Foundation is also working with children's schools in Maharashtra and other states. We are implementing topic guideline in Maharashtra. We have done, I mean, MOU in partnership with Health Department. So in Maharashtra, so we encountered that yellow line campaign, criteria number 8, that is already criteria is there in topic guideline that all these schools supposed to draw yellow line in school premises, right? So there is already criterion given by Health Ministry of India. So that is good in urban areas, but while we are implementing this criteria in rural areas, we face number of problems by the teachers and headmasters because there is no concrete road and they face problem like where they supposed to draw this yellow line, right? So such type of problems we face in basically in rural areas, not in urban areas, because urban areas there are concrete roads and all are there, no? So they're easy to paint that yellow line beside the schools. But where is in rural areas the farming, no road, no compound beside the schools. So that challenges we face in basically in rural areas. So how we encounter these challenges, if we get, I mean, experience or solutions, that will be great.
Hello.
Ji, sir.
Last, actually, your voice was not hello. Dr. Mahajan, sir, what he said last point actually.
Actually, he's having some problems regarding implementation in rural areas, I think.
Rural area, yes.
Yes.
So that's why I'm saying that there are some challenges, and one of the recommendation was there the panchayat, like a panchayat department and the panchayat members, and we have already started one activity in state Chhattisgarh. It's a Gaon Chale Hum. The whole guideline has been prepared. The messages actually it went to the ministry for the messages. Once it will be over, then it will be published. So there is a one terminology we are using, गांव चले हम for a तंबाकू नियंत्रण. तो थोड़ा सा जब लोगों में ये अवेयरनेस स्टार्ट कर पाएंगे हम थ्रू वेरियस एक्टिविटी और सम इनिशिएटिव, तो इट विल कम. और पंचायत डिपार्टमेंट कैन हेल्प इन ए वेरी गुड वे for making a school through a yellow line campaign or a toffee. And you are very much right. I'm saying there is a indicator for the toffee, but this yellow line is not the indicator. It may be a part of recommendation or a part of the guideline, but if we will use one of the indicator, yellow line has been made or not, it is like that. So thoda sa
You are muted, Dr. Kamlesh.
yes, we should use yellow line, or what will be the impact of yellow line, people will have a understanding. But yes, you are very much true ki in an urban area we are able to do it because a lot of resources are there with us, schools are there, and the NTCP cell is also having access to go in the schools and able to do it. But in the rural area, just because of the land also, you will, once you will come out the school, you will not find any very concrete based this floors, and the directly you will start the this soils and other things. So it is very difficult to do this type of activity. But the theme of the the key messages which can be through yellow line, it should be there. So challenges are there, I fully accept, and yellow civil society partners are coming forward to work for the village area or a rural population. So we should encourage all of them. That is my wish.
Yes, sir. And important thing is that now teachers are well aware about the Yellow Line campaign. Maharashtra and other states also observed. Right. Recently, I visited in Bhatapara, Chhattisgarh. So teachers are very much aware about the Yellow Line campaign, and now they are taking initiatives as their own to implement this criteria as well also. Because health department, Maharashtra health department, Salamboy education, we are taking initiatives to work on yellow line campaign especially.
Deepak ji, I think we need to give some time to others also.
Please.
But you can definitely communicate with us at cipher2018@gmail.com.
Okay.
Now, Dr. Kamlesh Jain, can you please confirm if MD Saab can join?
Yeah, actually, he just sent a message to his PA. Still, I'm in. Actually, he is a convener of the meeting, and ACS is chairing the meeting. So it was about to close by 4 o'clock, but still the meeting is going on.
It doesn't matter. We'll listen to Dr. Rakesh Gupta. He has got very elaborate comments on your this presentation.
Okay, मुझे कमलेश जी की जो है वो कैपेबिलिटीज पे बहुत भरोसा है, और मुझे पता है कि इनकी जो कैपेबिलिटीज हैं वो बहुत अच्छी हैं, और जिस पोजीशन में ये हैं वो एक एनवियस पोजीशन है, बिकॉज ही इज होल्डिंग द चार्ज ऑफ NTCP NPCDCS and several other health programs. He's also a very reputed and esteemed professor of community medicine. And he is a great mover of the things as implementer. My experience, although is not there at all in this yellow line campaigning, and I joined today's workshop primarily to learn from him. But as an implementer, yes, I do have some insights. And I was just introspecting, if I was in his place, what would I have done? And I consider that if we do the SWOT of this entire initiative, where S stands for strength, yes, we do have some strength here in form of his presence. That is what I would consider as critical. And the ongoing TOPFI program that is implementing throughout the state of Chhattisgarh, for which he has capabilities. So that is definitely very remarkable. But in the weaknesses, what I find is that the engagement of the two very important stakeholders here is, one is the municipal corporation or the members of the Gram Panchayat, and second, I think the retailers. This is missing. You cannot really have the yellow line campaign sustained unless these people are engaged, because you have highlighted that there is a crunch of the resources, and putting up the yellow lines with permanency is very difficult without this. The bureaucrats or the authorities will come and go after some months, perhaps, or a year. The secretaries will change, and again you will have the same issues. So I consider engaging the vital stakeholders is very important if you really wish to continue with this campaign. I also feel that right in planning this campaign, I don't know if Chhattisgarh had been the initial motivator to plan this, or whether it was done in the MP, which was the, I think, Green Line, and Gujarat also has done it, who started with it. But whether there are any surveys which shows how much impact does it have overall in the community or in the schools, the children, the school students and the teachers, how does it impact the tobacco use? Does it help in reducing tobacco use statistically or not? I think that requires to be evaluated. So I think that is another weakness I consider exists here in this yellow line campaign. I do see the opportunities, and I think opportunities in terms of what Dr. Deepak has said about the TOPFI program. And I don't know if the criteria 8 says that, yes, we should have a yellow line. I am not so sure. I have not read the guidelines very recently. So please correct me. But if it is, even if it is not there, I would say the TOPFI program gives you a kind of leverage that you can put up a line, or you can put up kind of another symbol for tobacco, becoming tobacco-free initiative within the school, which can be created by the students and teachers. It can be in the form of simply wall writing, or it can be putting the pebbles or the stones put up on the ground, actually, where this, because within the school premises, the principals can get a lot of things done. It doesn't cost much. And I think that is within the also within the capabilities of the NTCP and NHM, that it can motivate the schools that, okay, go for this, do the yellow line right at the gate in the school, which is not the domain of the municipal corporation or Gram Panchayat. But here within the school, you can do something where the students are entering in, so that they know that, yes, tobacco need not be used at all, or they should say no to tobacco. I think we are doing a lot for that. I think this opportunity I would consider, and this is a rule of simple rule of finance, that your returns are there where you invest in, and you should invest in a safe manner. And I consider TOPFI program is one program which gives us the safety of our investment, because you can definitely implement Code Pass 6A and B better if the students and teachers are more oriented, which Deepak has also said. So I think the threat here I see in this is that it cannot be sustained without the adequate funding. And Dr. Kamlesh, you know it very well, how the fundings come from the center and how these get utilized. And sometimes that's a very big challenge. But anyways, even if you get the funding in February and you need to finish it in March, I think if the funding is given to the school that, okay, this is the time, go for a big star or write tobacco free or make a yellow line within the school. I think that will be perhaps a bigger reminder which can be sustained by the students themselves, and the funding can be obtained even if you get 1 rupee, 5 rupee from the teacher, parents, or from the students. That can perhaps make a lot more difference than the depending on the people who will just come there for more like a photo op opportunity, but perhaps may not be sustaining it visibly. So I think visibility of sustenance or support of this program, if it cannot be given by the municipal corporations and gram panchayats, which is very difficult, and it's difficult for those who are implementing it and are working in the government because they have their challenges. They can't force the secretaries to do something which they don't want to do or they are hesitant about it. So we have to, in tobacco control, think little differently, that whether we are doing something which is giving us the returns, desired returns or not. But you are the person on ground, you know it the best as to how it is working and how effective it is. We will love to wait for the data because perhaps you can give it as a research topic to somebody, or a quick and dirty research as we call it, through some of these hundreds of schools as to how students KAP has changed because of the yellow line campaign. Perhaps that will help us to know a little more. Thank you very much for your patient learning, but I would like to have your responses, Dr. Rakesh, Dr. Kamlesh ji, as to what you think of my ideas. Our sessions are for learning from each other. So please, I apologize if I have in any way kind of given you the probing questions, Dr. Kamlesh. That's not my intent. It
Sir,
is.
it's absolutely, you are one of the mentor at the national level, and definitely I would like to learn from you. And it is a great opportunity if I'm able to talk to you and able to listen you for the particular focused topic. Yes, it is very much accepted that without municipal corporation involvement, we can't. And at the urban area, yes, we are doing it. For the rural area, without panchayat involvement, we will not able to give this impact. But I'm telling you continuously, it is a also part of it. We are also approaching in a different way. It is not only the yellow line campaign, and we will not able to show the impact of yellow line campaign because there are ample of activities going on to educate the people for a tobacco and tobacco issues. So like a toffee is also going on, and toffee is a part, actually yellow line is one of the initiatives, a campaign just for the sensitize the people, just to motivate the people to do something on tobacco control. It's a just for the people attraction. So this was I was taking yellow line in that way, and ample of activities like in a education material, even the mandate to teach about the tobacco harmful effect in a schools. These are the another factors which are working and which are going on actually. All yes, you are very much true. In a government system, impact will be through the right time. Like the if the fund flow will be in a right time, then only you will be able to use it. Otherwise, this money will be used within a month. You can see the impact of it. That is a truly, and I accept these type of things, but I really take care in my territory where I have on the control. I think the mission director also is entering in the room. If there is an opportunity, I would request to him to please join for a 5 minute just to address the. I will brief him first, and we can have interactions with him if you allow.
Yeah, Dr. Kamlesh, we can wait for him for some time. In the
No,
meantime, we
he's
can
just
have some
entering. Actually, he's entering. He has reached into the room actually. So we
Okay.
can have interactions with him, sir.
Okay. Okay.
Very
Okay. Thank you. Thank you.
So, so now he has reached into the chamber. I will just brief him, and immediately we can have interactions with him.
Dr. Sanchika, please put up a slide for CV.
So, Doctor, meanwhile, I just wanted to respond. The sir is just coming within a 30 to 40 seconds.
Okay, we'll wait for him. And I think there are very good suggestions from Dr. Rakesh.
Yes,
Gupta.
Dr. Gupta's suggestions, we have already noted it.
Yeah.
Definitely we will do something.
And another thing I want to talk about is Ms. Neilata. She has touched upon the topic regarding availability of electronic cigarettes, especially in metro cities and even towns like Chandigarh. It is available. These products are available online. So we need the teachers. They need to be aware about these products so that these can also be tackled. And we already have a ban on electronic cigarette through a central act, that is Prohibition of Electronic Cigarette Act. So all teachers, they need to know about it. So Dr. Kamlesh, whenever you give you do awareness activity, do touch upon this also.
Yes, sir. The
And
electronic.
also,
Yes, sir. We are working for the electronic cigarettes, sir. Across the country, first after 2019, sir, we in a Bilaspur, this was the first case actually lodged. So now I would request to our mission director within a
So it is good that MDNHM has been able to spare some time. Yeah. So that is great of him.
He is a man, sir, who always speaks for 1 or 2 minutes in every meetings regarding the tobacco control. And sir, just wanted to introduce our mission director is right now with us, Mr. Vilas Bhoskar from Indian Administrative Services, and mission director for the state of Chhattisgarh. Sir, 78 people are attending across the country.
Yeah.
And just we were talking about this yellow line campaign, and schools should be free from the actually tobacco. And Chhattisgarh is doing something good, so they invited us to share the activity. And what is your stake on the tobacco control? Uske thoda sa batane ka.
Thank you, Mr. Vilas Bhoskar, that you have been able to join. And we know that you are a busy person and you have straight away come from a meeting. So we'd like to know about your comments on this issue, please.
थैंक यू सभी को बहुत बहुत धन्यवाद डॉक्टर साहब आपको भी धन्यवाद सॉरी कि मैं लेट हो गया
नहीं कोई बात
सारा मीटिंग होता है तो सब जरूरी भी है
हाँ जी
तो जितने भी आपने 79 जो पार्टिसिपेंट जुड़े हैं सभी को नमस्कार तो हम हमारे मतलब छत्तीसगढ़ में किस तरह से टोबैको कंट्रोल के लिए काम कर रहे हैं सबसे इम्पोर्टेंट ये है कि हमारे टोबैको कंट्रोल के लिए माननीय मुख्यमंत्री जी और हमारे स्वास्थ्य मंत्री जी उसमें इतना कंसर्न है कि उन्होंने हम लोगों को जाके हमारी टीम जाके ऑस्ट्रेलिया और न्यूजीलैंड में टोबैको फ्री में उन्होंने घोषित किया है तो और किस तरह से वो स्ट्रैटेजी कर रहे हैं वो देखने के लिए हम गए थे तो आप समझ सकते हैं कि इससे कि हमारा टोबैको कंट्रोल के लिए टोबैको फ्री स्टेट के लिए हम लोग किस तरह से आगे बढ़ रहे हैं टॉप प्रायोरिटी से मतलब जो पॉलिसी मेकर्स है सीएम साहब है स्वास्थ्य मंत्री है हमारे जितने भी जिले में काम कर रहे हैं हमारे एनएचएम के है हेल्थ के जितने भी विभाग है स्टाफ है और अधिकारी है ये सभी लोग कमिटेड हैं स्पेशली हम सबसे चालू हमारा फर्स्ट फोकस रहेगा कि वो स्कूल से बिकॉज जस्ट एक मैं आपको इंसिडेंट बता रहा हूँ कि 4 दिन पहले मेरी छोटी बेटी है 5 साल की तो वो बोल रही थी कि पापा वो तो अभी बहुत सारे उसके पास क्वेश्चन है बच्चों में होते ही है तो पूछ रही थी कि पापा ये लोग जो है ना उनका एक जो राइट या लेफ्ट जो होता है चीक होता है ना थोड़ा सा फुला हुआ क्यों रहता है मुझे थोड़ा डाउट आ गया मैं बोला अरे बेटा ऐसा तो होता नहीं हो सकता है कि खाना खा रहा होगा तो उस समय हम खाना खा रहे थे तो बोले कि मैं खाना खा रहा हूँ तो थोड़ा सा फुला हुआ दिखता है इसलिए नहीं बोले पापा नहीं वो खाना नहीं खा रहे थे खाते हैं फिर भी उनका एक चीक है ना वो फुला हुआ रहता है थोड़ा मोटा रहता है अंदर कुछ ऐसा तो फिर मैं बोला यार ऐसा क्यों पूछ रहे तो दूसरे दिन मैंने उसको स्कूल में छोड़ने के लिए गया 8 बजे तो उसके सराउंडिंग में जो देखते थे जैसे उनका वॉचमैन है पढ़ाने वाले है ये है तो उनको देख के मुझे पता चला कि वो क्यों बोल रहे हैं कि खुला हुआ मुंह क्यों रहता है मुझे पता चला कि खुला हुआ मुंह इसलिए रहता है कि वो कुछ ना कुछ टोबैको या ये उसमें अंदर रखते हैं और खाते रहते हैं मतलब अपना आने वाला जनरेशन किस तरह से लोगों को देख रहा है उसका एक बेस्ट एग्जाम्पल हाँ तो मतलब वो पूछ रहे हैं कि ये फुला हुआ मुंह क्यों रहता है कि ऐसे इंसान होता है क्या तो ये सवाल वो जो आने वाला जनरेशन पूछ रहा है कि भाई ये जो हमारे पहला जनरेशन है, मेरे पिताजी है, उनके पिताजी, इन लोगों ने जनरेशन को किस तरह से जो बच्चों को क्या देखने के लिए हम छोड़ रहे हैं। तो इसलिए हमने इसको ध्यान में रखते हमने स्टेट से ही चालू किया है कि जब स्टेट से चालू करेंगे तो स्टार्टिंग करेंगे बच्चों से। तो बच्चे सबसे बड़ा मैसेंजर भी होता है और सबसे बड़ा लो हैंगिंग फ्रूट भी होता है जिसको मोल्ड कर सकते हैं। उनका साइकोलॉजी है, उनको ये करना है, और वहां से एक बार चालू कर लिया तो फिर मानिए फॉर एग्जाम्पल बच्चा है, अगर उसका स्कूल का आसपास का एरिया अगर टोबैको फ्री करेंगे, बिकॉज गवर्नमेंट ने तो टोबैको और जो गुटखा है उसके लिए बैन कर लिया, लेकिन इंसान ऐसा है कि वो उसको बहुत सारे मार्ग निकालता है, तो उन्होंने दो उसको डिवाइड कर लिया, दोनों को मिक्स करके खाने का भी एक मैकेनिज्म बना लिया। तो ऐसा है कि इसलिए जितना भी है, इसलिए एज अ लॉ, एज अ प्रोहिबिटेशन जो हम लॉ बनाते हैं, उससे अच्छा है कि मुझे लगता है जो सोशल चेंज है, जैसे माननीय प्रधानमंत्री जी द्वारा स्वच्छ भारत मिशन लॉन्च किया था, अगर 14 की बात करेंगे और अभी हम 16 की बात करेंगे और हम लोग 23 में 6-7 साल में देखेंगे, तो वो सोशल मोबिलाइजेशन का और सोशल चेंज का ऐसा एक नमूना है कि 7-8 साल पूर्व में हम अगर देखेंगे कि ओपनडिफिकेशन और आज का दिनांक देखेंगे, 99.99% वो खत्म हो गया, बिकॉज उन्होंने कोई लॉ इन्फोर्स नहीं किया, उन्होंने सोशल चेंज लाया। तो सोशल चेंज के लिए हम ये सोचते हैं कि सोशल चेंज चालू करना है तो किससे चालू करना है, बच्चे से चालू होना चाहिए, बिकॉज बच्चा सबसे बड़ा मैसेंजर भी है। और जो लोग खाते हैं, मतलब ऐसा जरूरी नहीं है कि जो पढ़ा लिखा खाता नहीं पढ़ा, जो अनपढ़ खाता है, ऐसा भी नहीं है, लेकिन बच्चा चेंज करने के लिए एक मैसेंजर भी घर में अगर जाएगा और उसके पिताजी उसके पास में आएंगे और बोलेंगे कि कुछ खा रहे हैं, और वो बोलेगा पापा आपका तो बहुत बदबू आ रहा है, मैं आपके पास नहीं आऊंगा, अगर वो हिट अगर वो इंसान को मिल जाता है, जो भी हो, ऑफिसर हो, जो मजदूर हो, मेल हो फीमेल में जो भी हो, तो उसको जो हिट मिल जाता है, तो वो सोशल चेंज का एक बड़ा ऐसा फैक्टर होता है कि यू कैंट इमेजिन। हम बच्चे को तो ना बोल सकते ना कुछ समझा सकते, जैसे मैं नहीं समझा पाया मेरी बेटी को, तो ऐसा ही इसलिए हम लोग चालू करेंगे, स्कूल से चालू किया है। तो स्कूल के एरिया में 100 मीटर एरिया में, जैसे इलेक्शन में 100 मीटर एरिया के अंदर प्रचार प्रसार नहीं कर सकते हैं, वैसे हमने एक निकाला है कि 100 मीटर के एरिया में पेरी पेरी में स्कूल में कहीं भी टोबैको को प्रोडक्ट टोबैको ये है उसका इस्तेमाल नहीं होगा, अगर होगा तो हम उसमें कार्रवाई करेंगे। और स्टेट से भी हम लोगों ने सभी कलेक्टर्स है, सभी इम्प्लीमेंटिंग एजेंसी है, पुलिस है, एक ज्वाइंट मीटिंग भी हमने लिया था, तो वो हम स्ट्रिक्टली इम्प्लीमेंट कर रहे हैं। तो दूसरा चीज है कि हम लोग ये करने जा रहे हैं कि जो भी टोबैको खाता है, गुटखा खाता है, वो क्यों खाता है? तो इसलिए खाता है कि उसको स्ट्रेस होता है या ऐसा टाइम पास खाता है या जो भी है, बिकॉज जो साइकोलॉजी इंसान की होती है उसको प्रिडिक्ट करना और उसके अनुसार उसको चेंज करना बहुत टफ बात होती है। तो साइकोलॉजिकल अगर हम देखेंगे कि जो स्टाटा खाता है, जो लोग खाते हैं, तो गुटखा खाने वाले या तंबाकू खाने वाले ऐसे लोग रहते हैं कि जो मजदूरी करते हैं या जो मैनुअल वर्क में ज्यादा इन्वॉल्व है, या जो फ्लोटिंग पॉपुलेशन टाइप, जो बिजनेस क्लास है या ये है, तो उनको देखेंगे तो उनका नशा करने का अलग टाइप होता है, जो मजदूर है उनका अलग टाइप होता है। तो इसको ध्यान में रखते हमने सभी जिलों में स्पेशली जो हमारे पीडीएस शॉप्स है, बिकॉज पीडीएस शॉप में ऐसा है कि छत्तीसगढ़ में हम लोग 35 किलो पर फैमिली पर राशन कार्ड देते हैं, और हर दिन में पीडीएस शॉप में क्या होता है कि 4 तारीख को चावल उत्सव होता है। चावल उत्सव मतलब क्या होता है कि उस दिनांक में सब फैमिली वाले आएंगे और सभी को चावल, जो शासन की योजना है पीडीएस में 1 रुपया पर केजी का है, वो सभी को देते हैं। तो वो एक माध्यम है कि हर फैमिली का हर व्यक्ति आता है, चाहे वो फैमिली का मेल हो, फीमेल हो, बच्चे हो, तो वो एक स्टार्टिंग पॉइंट वहां रखा है कि वहां हम प्रचार प्रसार कर रहे हैं कि यार तम्बाकू खाएंगे तो क्या होगा, और नशा करना है तो उससे दुष्परिणाम क्या है, मतलब उसके साइड इफेक्ट्स क्या है। तो ये जो वाला है, बिकॉज अधिकांश जो है जितने भी हमारे पास में 74 लाख फैमिलीज हैं छत्तीसगढ़ में, बीपीएल है, वो अधिकांश राशन कार्ड से जुड़े हुए हैं। तो कहीं ना कोई और पीडीएस शॉप में आता ही है, जिसके लिए ये चावल लेने के लिए, और मंथ में वो आएगा ही आएगा। दूसरा है कि ये धान खरीदी जब हमारा होता है, तो धान खरीदी में जो भी किसान होते हैं, किसान या जो मजदूर होते हैं, वो वहाँ काम करते हैं। धान खरीदी हमारे पास में एक 1,100 करोड़ से भी ज्यादा का हम मीट्रिक टन में खरीदते हैं। और वहाँ जो लोग आते हैं, ट्रक ड्राइवर भी आते हैं, उसके लिए वहाँ जो मजदूरी करते हैं वो भी लोग वहाँ रहते हैं, जितने भी किसान हैं वो भी लोग आते हैं वहाँ बेचने के लिए। तो ये जो एरिया है, वो जो हमारे पास में जितने 2,000 के आसपास सोसाइटी, जहाँ वो लोग आके ये कर रहे हैं, तो हमने दूसरा एक टारगेट रखा है कि वहां हम उसको प्रचार प्रसार करें। अगर ये दो एरिया अगर हमने उसको कंट्रोल कर लिया और वहां अगर हम उसको समझाने में कामयाब रहे, तो बाकी वाला जो सोसाइटी का पार्ट बचता ही नहीं। तो ये दो एरिया है, जैसे पीडीएस शॉप्स जहाँ सब आते हैं, और धान खरीदी केंद्र में जो धान बेचने के लिए लोग आते हैं, वहां मजदूरी भी करते हैं, ट्रक ड्राइवर भी रहते हैं। तो ये जो अक्टूबर, नवंबर, दिसंबर, जनवरी, फरवरी, ये जो पीरियड है हमारा धान खरीदी का, वो इट्स लाइक एक फेस्टिवल होता है छत्तीसगढ़ में हमारे। तो उसमें हम उसको लेते हैं और वहां हम प्रचार प्रसार करते हैं। तो एक धीरे धीरे, बिकॉज ये सोशल चेंज लाना है, जैसे हम लोग 80s में देखेंगे, फैमिली प्लानिंग का देखेंगे, पोलियो का देखेंगे, हेल्थ में जब भी हम कोई कैंपेन चलाते हैं तो उसको स्टार्टिंग में थोड़ा दिक्कत आता है, बट एक बार रिवोल्यूशन सोशल चेंज चालू हो गया तो इस तरह से होता है कि फिर अगले समय में हम उसको इतना इफेक्टिव हो जाता है जब जन भागीदारी जो होती है, जैसे माननीय प्रधानमंत्री जी बोलते हैं कि जन भागीदारी, जिनके लिए योजना है उनके लिए, उनको ही अगर हम पार्टिसिपेट नहीं बनाएंगे और उनके लिए ओनरशिप नहीं रहेगी तो हम कितना भी बताएंगे तो कुछ उसका फायदा नहीं। तो इसलिए ये जो जन भागीदारी है, माननीय प्रधानमंत्री जी हमेशा बोलते हैं कि जन भागीदारी, वही जन भागीदारी की वो लोग जिनके लिए है उनको हम इसमें पार्टिसिपेट करा रहे हैं। तो एक सोशल चेंज है, उसको थोड़ा वक्त लगेगा। ऑफ कोर्स कोई भी चीज थोड़ा कितना भी फास्ट करे, जब तक सोशल चेंज जो होता है इट्स लाइक मतलब वो कछुए की चाल चलता है, बाकी जो चेंज होता है बहुत फास्ट चलता है, बट सोशल चेंज हमेशा बहुत धीरे धीरे होता है। तो उसको ध्यान में रखते हैं हमारे पूरे राज्य में एक बार अभी हम लॉ भी ड्राफ्ट किए हैं, जिसे हमें कैबिनेट में पुट अप करना है। उसके जो भी बेचेगा उसमें पेनल्टी है, स्पेसिफिक क्वांटिटी से ज्यादा बेचेगा उसमें है, उसके बाद मैन्युफैक्चरिंग में जाएगा तो लो निकोटिन वाला है उसमें भी जाएंगे। तो धीरे धीरे हम लोग हमारे राज्य में टॉप प्रायोरिटी हमारे सीएम साहब की भी है, हमारे स्वास्थ्य मंत्री जी की भी, तो उनसे भी गाइडेंस मिलते रहता है। तो आने वाले समय में हमारा एक टारगेट है कि आने वाले 5-6 साल में एटलीस्ट जो हमने 3-4 एरिया बताए हैं उसको टोबैको फ्री भी करें और उनको डिस्करेज भी करें। तो सोशल चेंज है, थोड़ा वक्त लगेगा बट हम उसको जरूर करेंगे। तो आप लोगों को धन्यवाद बोलना है, बाकी
बहुत बहुत
साइफर से
शुक्रिया
डॉक्टर
आपका।
राकेश हैं सर, और उनको सर्जन डॉक्टर राकेश गुप्ता है यहाँ पर।
हाँ,
बाकी फिर
आपको बहुत बहुत
बहुत
धन्यवाद
बहुत
सभी
शुक्रिया
लोगों को।
आपका कि आप थोड़ा सा टाइम स्पेयर कर सके। और मैं ना, आप थोड़ी देर के लिए रुके तो एक तो मैं सबसे रिक्वेस्ट करूंगा अपने वीडियो ऑन कर लें सो दैट वी कैन हैव अ स्नैपशॉट। और एमडी साहब आपका बहुत बहुत शुक्रिया, और जो आपने बताया कि आप क्या क्या कर रहे हैं। और उसके अलावा मैं एक ये चीज पे स्ट्रेस करना चाहूंगा कि जो लोग छोड़ रहे हैं उनको छुड़ाने का भी प्रबंध होना चाहिए। जैसे टोबैको सेसेशन सेंटर्स है, वो कमलेश जी को पता होगा कि वो उसकी क्या इंपॉर्टेंस है टोबैको सेसेशन सेंटर्स की। और कई जगह आपके मेडिकल कॉलेज में या डिस्ट्रिक्ट लेवल हॉस्पिटल्स हैं, डेंटल कॉलेज उनमें होंगे, मगर हम चाहते हैं कि सारे कॉर्पोरेट हॉस्पिटल्स में भी, जो प्राइवेट हॉस्पिटल्स में भी हों, और वो सब डिवीजन लेवल पे के हॉस्पिटल्स में भी कम से कम हो। तो इस पे भी डॉक्टर कमलेश आप जरूर इनको बताइए सर को। और आई थिंक दैट वुड बी गुड दैट इफ वी हैव टोबैको सेसेशन सेंटर्स एट ऑल प्लेसेस। सो बहुत बहुत शुक्रिया। बस 2 मिनट, डॉक्टर संचिका आपने ले लिए क्या स्नैपशॉट्स?
हाँ सर, ओके।
अच्छा, ले ली। तो 2 मिनट के लिए मैं, डॉक्टर अरुणा है हमारे पास ना, शी इज अ वेरी सीनियर डेंटल सर्जन, तो उनके बस कमेंट्स, बस लास्ट 1 सेकेंड बस। डॉक्टर अरुणा, वी कैन गिव यू जस्ट अ मिनट फॉर द कमेंट्स। यू आर नॉट ऑडिबल डॉक्टर अरुणा, यू आर नॉट ऑडिबल। हाँ जी, आपकी आवाज नहीं आ रही, पता नहीं, वो वॉल्यूम का देखिए। आपका ना वो ऑडियो ठीक नहीं है। चलो, जब तक आपका ऑडियो नहीं ठीक होता, डॉक्टर राकेश गुप्ता, जस्ट योर लास्ट कमेंट्स।
Thank you very much, Bhoskar sir, and we are delighted to get addressed by you. My only issue which I have talked to Dr. Kamlesh ji is that the key stakeholders, which are primarily the parshads from the municipalities and the gram panchayats, do not appear to be very active participant here as stakeholders. So who is actually owning the yellow line campaign? If this is medical and health department, my question is, can we get the first funding in the sustained manner? With all due regards and humility, I would say, if you are not there in the seat who is a very supportive of tobacco control campaign, because this is what we have observed in last over 2 decades of our working in tobacco control, that many a times if the key leadership changes, then we do not get the desired support. That is one. And consider this, please, as well, that if there are more effective solutions, something like tobacco-free generation, which has got a wider effect. You stated that you had visited New Zealand, so you must have heard about tobacco-free generation. Can Chhattisgarh consider having a policy for tobacco-free generation where one can decide that, okay, the children born after a particular date will not be using tobacco at all in future? Whether these two things are doable, these are my questions to you, sir.
हाँ जी, डॉक्टर कमलेश।
he got the urgent actually one interventions immediately in the office. तो tobacco free generations पे बात कर रहे हैं सर, जो अभी न्यूजीलैंड में हमने देखा तो it will have impact. So definitely sir. So now actually I would like to reply this Dr. Rakesh Gupta sir's message. Yes, we visited. I was also part of this visit, sir, for this tobacco free generation New Zealand, and there was a talk actually in New Zealand, and we attended it. Our mission director, Honorable Health Minister. So the best part of it, 2 hours we only talked about the tobacco control and tobacco control initiative over there. The only point is in India we have completely banned the tobacco, this electronic cigarette, but there in New Zealand they are not stopping tobacco, actually electronic cigarette. It's like a slowly they wanted to stop it actually through some small dose management or other things like that. So that was one of the point which we have learned over there, but right now in India it will not be workable because India we have already banned it. So a huge population
Tobacco-free generation, New Zealand, the law of New Zealand definitely has the scope for use of electronic cigarette in a medically supervised manner. It also has, in addition, a mandate to reduce the number of retailers to 10% over a period of a few years. But my question is, can Chhattisgarh take the initiative for deciding on the cutoff date for the children who will never be tobacco users? This is an opportunity. If you all have gone there, and if that is something which can be discussed within the state, and if Chhattisgarh becomes the first state,
will you not believe our honorable health minister and the secretary who were actually who were the part of the visit, actually even mission director, all are ambitious to do something on a tobacco free generation.
Wonderful.
But you know it is a policy matter. Once the our honorable health minister would like to talk with the chief minister, and then you know the election is also coming, so it may be a agenda of the health, it may be declaration. So we are trying to include in the agenda. It's a white paper which we prepare for the elections, na sir, the Ghoshna Patra. So if it is possible, we will do it. Even mission directors are always part of the meeting actually, though I would request to him also, but I cannot state anything in a public mode right now. You can understand very well. Even our mission director will not speak on it. But definitely, once the chief minister will give green signal, then we will make some strategy on it. That will be the one of the reply from my side, sir.
And Dr. Kamlesh, I think he should even CM and all politicians must know that good public health initiatives, they are vote catchers also. So this is a election year, so maybe they agree to it.
Definitely.
So thanks a lot. And Arunaji, can you just speak? Still, your audio is not good. No, I'm really sorry. We just can't hear you. There's problem with the audio. Doesn't matter. You can just write me a mail if you have any queries. And I think it's already 5:24, so we are 24 minutes behind the schedule. So I'll request Dr. Sanchika, are you with us? Or Dr. Baljit, Dr. Baljot. So Dr. Baljot, you can please propose a vote of thanks, please. Dr. Baljot, are you with us? So I like to thank all the participants, all the resource, like Dr. Kamlesh Jain, he was the main speaker, and MD Saab, he was our chief guest, and it is very commendable of him that he has been able to spare some time, and also I think he's doing this tobacco control work in a very proactive way. And Dr. Kamlesh Jain has been able to involve all the stakeholders in this initiative. So I'll also like to thank Dr. Sonu Goyal, Mr. Arun Verma, Dr. Sanchika, and Dr. Rakesh Gupta is with us, Ms. Snehalata, Dr. Aruna, Dr. Siddhi, Susan ji, and all other eminent experts who have been involved in this, and all our participants. And we were actually close to 70 people who had joined us, and it is really commendable. And it shows that how much interest Dr. Kamlesh Jain has generated. So, Dr. Sanchika, I have already proposed a vote of thanks, and you can just, your final comments, please, Dr. Sanchika.
Thank you, sir. So I think it was a very nice session today, and we had a very good engagement within the crowd as well, which is expected in the future sessions as well. This also means that we didn't have an interaction in the last sessions. That was also wonderful, but please continue this way in the future time as well. So the last is I wanted to talk about our next session, which is on 31st of August, and it's a topic is establishing quit line in Rajasthan, and the speaker is Dr. Rakesh Gupta, founder of Rajasthan Cancer Foundation. We will hear to sir again on 31st of August. Thank you so much for joining us today. Namaste.
So thank you all. Thank you all. Thanks.
Thank you, sir. Thank you.
Thanks a lot.